So most people come onto a physio site looking for questions and answers more about physio really than kind of about us. And you three are obviously the people who are answering the phone and speaking to patients on a daily basis. So you are probably in the best position to answer the question of what are the most frequently asked questions of physio.
I'd probably say they're wondering what to wear. Whether, it's just come in something like a vest.
Do they need to remove clothes? That's a big thing.
Yeah.
Jeanette's experience.
Have you got experiences of...
You should know.
I didn't tell you to take all your clothes off. I told you to keep them on.
She was too eager.
What about you? What was your... I remember when you first came in to see me for your...
Yeah, when I came to see Paul for the first time, he said, if you just want to... well, I thought he said take your top off.
Can I just explain? The person obviously who's watching, Vicky, this is Vicky, this is Kim, and this is Jeanette. But Vicky came to see me about 4 years ago. Vicky came in originally to see me with a shoulder injury and left with a job. So she obviously has great experiences of physiotherapy, but we used to joke about it because you weren't quite sure whether you needed to take clothes off or not. I leave the room? I left the room, didn't I?
I had a vest and a cardigan on, and he said, if you just like to take your top off and lay on the bed with your head in the hole. And I took my cardigan off and I was umming and ahhing thinking, do I take my vest off? And I was even actually holding my top, fighting myself thinking, do I need to take this off? Luckily I didn't, and when Paul came back into the room I said, do I need to take my vest off? And he was like, oh no. I said, God, I was nearly hearing my bra. And he said, I wouldn't have said anything. And so that would have been quite embarrassing if my boss had seen that now.
Might not have got the job if you...
Yeah, I definitely wouldn't have got the job if he had seen that.
And what about you? So you asked me... You were pretty confident you just wanted to take yours off.
My top off and then I laid on the bed and I said, do you want me to take my bra? Should I take my bra off? And you said, no, just pull you strapped down.
I don't know what she thought about physio for the first time. What did you think?
Or was it just me?
It's because, like people do think when they come in for, if they're new to it, or come into a physio appointment, they associate it with going for an hour's massage, half an hour massage, lying down, taking your top off, lying down there and having half an hour massage or something. And that's what some people think that
physio is. Yeah, I find that when I speak to people after treatments and I'll say, what were you expecting? Is it what you expected? And they'll say, no, I expected to come for a nice massage, kind of like what you get in a hotel.
Yeah.
And it's obviously not
some
that.
people do ask on the phone, is it an hour's appointment that I get? And because that's what they associate.
Obviously, but doing a physio session for an hour on one particular body part would be too stressful.
Yeah,
more often than not. Yeah. So we've got the clothes question that you don't need to take your clothes off, but you can if you want. Yeah. You can if you want. But preferably we leave them on. Yeah. The next question.
Is it going to hurt?
That's a big one. When I speak to patients, their initial perception, and sometimes what puts them off coming in for a long time, is that they think that it's going to hurt. And I usually find that when you explain to them that it's probably going to hurt no more than the pain they're already in, you've just got to explain it that way. Yeah, it's usually physios when we stop doing what we're doing, our pain stops, and you're still in the pain that you were in, so it's going to be no worse, or certainly not going to be in a worse situation than you would have been pre that. So we've now got clothes. How much pain are you going to be in?
But the pain is a good pain.
And it's temporary, isn't it?
It's temporary, and you can feel straight away when the area that they're on, it's doing some good. It's uncomfortable for, I'd say, it's not really uncomfortable.
It's not, you can bear it.
Yeah.
But
it's a good pain. That's how I would describe it, a good pain.
What do patients say when they, for example, they've been in reception, you've been chatting to them, and then they've gone in for the treatment? Can you notice a difference? Are they relieved? How do they feel when they come out? Are they
like an sigh of relief? They all walk out and we always say, was it as bad as what you thought it was going to be?
Yeah.
And they're like, no,
and then some of them say, it was painful, but I feel so much better for having it.
Yeah.
Do you notice a change in people then?
Oh yeah.
Yeah.
So think back to your own experiences now. I'm interested in, because now you've got obviously a story to tell before your own treatment, and now you really hopefully have a really good idea of what physio is and what it does. Vicky, think back to when you had your shoulder injury. What caused it, and what in the end made you want to come for physio, and what were you thinking before you came in?
how many questions all in one go? I just remember the first one. I think mine was due to bad posture where I used to work. We all used to just hop in different chairs, so the seating was never correct. So I was suffering from really bad shoulder and neck problems. I left it, I would say, 6 months, and what I actually did...
Any reason? Why did you leave 6 months?
Because I just kept getting the girls to karate chop my neck and rub my neck, so I was like...
That worked.
It eased for that minute. And I didn't actually know much about physiotherapy. I didn't know...
So what was the push?
The pain.
And what?
A recommendation, actually, I got. One of my friends had been to see Paul previously. So I thought, I'll give it a go, see what you can do. And
what were you like on the day? What, were you apprehensive, or what was going through your head?
I actually thought I was going for a nice massage. I thought they'd have made a bit of music.
Little jacuzzi in the car, like all that afterwards. Yeah. You got me.
Okay, Paul. That's what I thought. And obviously when I was in there, it's not a therapeutic, chilled out massage.
Jeanette?
Well, I came because of my whiplash that I had to my neck, but because I was doing a lot of swimming as well at the time, so it was never relaxed. I always had that tension there. But for me, I absolutely looked forward to it, and no matter how painful it was, I just loved having that treatment because it was such a relief when you're doing sports. No matter how, you get such a build-up of tension, and it didn't matter how painful it was, after that was such a relief to have it, what's the word I'm looking for? Just to have it,
released.
To feel relaxed. But I think when you're doing sports, it's something, and you've got an injury, you kind of keep on top of it constant, I think.
So physio's not too bad?
No. Oh, it's wonderful.
Well,
what was it like doing a job interview during your physio sessions? Did you realise that's what happened, really? I gave both of you the jobs on the basis of interviews in the sessions.
Well, it can't be that bad because even now the physios like to do different techniques on us, and all three of us are fighting to get in because we just want to go in and have our back clicked, or so it can't be that bad if we all fight to get in.
So if you got your job on the basis of a physio session and you got your job on the basis of a physio session, how did you get your job, Kimberly?
You got me the
I
job.
think you just walked past me in the street and thought she'd look good behind the desk. Obviously, I've had physio previously for ankle injuries. I play a lot of netball, and it's something that I needed to keep on top of, like ankle injuries. Obviously, being a netballer, ankle injuries is like the main injury that you would probably get through netball, and it's something that people just shrug off and think, oh, I'll just have a few painkillers and I'll be fine the week after. But it's something that if you don't really get it sorted out straight away, it's something that obviously is recurring and it can come back.
Have you seen netballers who just have problems all their life because they haven't got stuff sorted out early?
The more I find people put a lot of their injuries off at netball because I think that it's going to make them look a little bit soft if they come for physio, and it just makes everything worse in the long run because they haven't had things sorted in the past. It just gets worse and worse, and then you end up not being able to play netball for as long as what you wanted because of the injuries that you previously had not treated.
Think now back again to patients when they come in. Can you instinctively pick up on somebody when they ring or when they come into reception if they've ever had physio before?
Sometimes the wording that people use, we can tell if somebody knows specifically.
I think if they're asking what to wear and
yeah.
asking what's happening and does it hurt and things, then they're nervous, they're new to it, they've never really experienced these things.
And what about the changing them as the weeks go on?
Oh, they become
relaxed,
isn't
yeah,
it? So chilled and so friendly. Like how we get on with patients is
more like friends, isn't it?
Yeah.
I mean, we've got a lot of patients now that are more like friends to us than what we would say that they were patients. That, they're coming in, we can just talk to them as if we would ring one of our friends up on the phone or anything like that.
What's the best thing about your job?
The people who we meet.
I was going to say working with you, but since you didn't.
Well,
like I said,
stick the boot in.
The people who we meet, that could be generalised to you as well.
Don't touch me now, don't slip up.
What shocked you about working in a physio environment or this environment?
What shocked us?
Yeah, anything that this happens on a daily basis that you didn't think could happen or would happen. compared to, let's say, a dentist where you've worked in the past? Is it different?
Well, we get a lot of thank yous. We get gifts from people, which you know that you've obviously made a lovely connection with them for someone to be so kind to do that. That was something I'd never come across before where I've worked.
I think it's just like more of a relaxed atmosphere. I mean, you think physio and you automatically think it's a clinical place, and you think that everything's just going to be strict and like not friendly or welcoming, whereas working here I feel like it's a more relaxed atmosphere, and I think that rubs off on the patients, so they feel more relaxed when they're going in for their treatment than what they would going to an actual clinic.
Like seeing a doctor,
Yeah.
you go to the doctor's reception. Sorry, your mum works in one.
But she's always in here.
Sorry,
She spends more time in here than she does in the doctor's surgery.
The reception, it's very, there's a barrier, and it's, you can't speak with them, you can't.
Once you've checked in, you've
It's-
gone to
yeah.
see out the word.
That's you gone, whereas here you don't get that.
What you get here?
Maybe
Coffee, TV. Yeah.
Our life stories.
I know. Agony ends.
Yeah.